Hello everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked, and today's session's all about menopause, mental health and brain fog. Now, just as a few more people join us, I just thought I'd share my experience of brain fog, and I thought long and hard about whether I should share this at all. But I think it's important that we all talk about it. So this is me coming clean. I imagine an auditorium filled with hundreds of people, and I talk every day, run training sessions, run webinars, and I stood up in front of this auditorium and my mind went completely blank. There wasn't a single thing in there. Have you ever experienced that? Now, I'm very embarrassed. I was complimented after the session for my reenactment of brain fog, but in reality, it wasn't an act at all. It really did happen to me. And to get through it, I really did have to hold everything together. I felt deeply embarrassed, and as you can imagine, it really did chip away at my confidence. I think I walked away from that session thinking, I'm not sure if I ever want to do this again. But actually now, my coping mechanism is I'm very rarely seen without my notes. In fact, I think I would say I'm probably a listaholic. So if you're experiencing brain fog, and I'm delighted to welcome back Dr Shahzadi Harper by popular demand, who's going to talk us through what's actually going on in our body, what we're experiencing and how it can affect us, and just as importantly, what we can all do about it. So welcome, Dr. Harper. Am I on my own?
No, you're not on your own at all. And I would say, sort of 60% of women do experience this around this time. And when I talk about around this time, I think I'm talking about perimenopause. And talking about the stages that women go through of hormonal change. Sort of premenopause is when you're just your usual self, sort of 20s, 30s, but come the 40s or late 30s for some women, sort of your ovaries start to change, change producing the hormones, estrogen and progesterone and testosterone. And one of the lesser known symptoms I think women are aware of when it comes to menopause is brain fog. And very much like you said, women become forgetful, they lose their train of thought, they find it harder to concentrate, they find it harder to stay focused and sharp. And often I see a lot of women talking to me and asking me, have I got early dementia? It can be funny once in a while that you find your keys in the fridge, but when you miss a meeting or you miss an appointment, or you've forgotten what you were meant to do in your to-do list at work or something, it can get really embarrassing. So I think definitely you're not on your own, and it really impacts a woman's confidence and her ability at work and in the workplace.
Well, I said, thankfully, it doesn't happen to me very, very often. In fact, that was a one-off. But you do have to have your coping mechanisms ready. But what's actually going on in our body that triggers those psychological symptoms that really can chip away at your confidence?
So brain fog isn't an actual medical term, but it's an umbrella term to sort of encompass memory loss or forgetfulness, also difficulty in concentration. And what's going on is that estrogen, the hormone estrogen, acts a little bit like Wi-Fi in our brain to help with connectivity. And because when we are in perimenopause, our ovaries are producing less of that hormone estrogen, and also less of testosterone, then what tends to happen is that our Wi-Fi goes down, or it's not as connected as it used to be. And so, joining the dots becomes a little bit harder. And, you must all know at home, when your Wi-Fi goes down, the amount of sort of tantrums and, everything that can go wrong at that particular moment, everybody gets sort of annoyed. And I think that's the same kind of thing. That's an easier way of sort of understanding it. Also, there's the aging process. There are lots of factors going on around this time. We have to accept aging as part of what's going on in life. And also as women, we've probably got a lot more that we're juggling right now than we did maybe in our 20s or so, sort of family, children, work, parents, so many things to sort of remember that I think sometimes we can also be a little bit hard on ourselves.
Thank you very much. Can I pick up on some of the things that you just said there? I mean, first of all, when you say it's an umbrella term, we know when we did the research with the TUC and the Government Equality Office team, we were surprised that psychological symptoms came out top in that survey. It's often the symptoms people don't know to expect and don't know how to identify them. So things like anxiety, as well as worry and forgetfulness and lack of ability to concentrate. But you also mentioned the stages there of menopause, because most people know that menopause is the time when you've not had a period for 12 months, but perimenopause is actually this mysterious time. You don't get notification that you're entering it at all. And that's where it can be very problematic, isn't it?
And perimenopause is different for each woman. And perimenopause can start 10 years or so before your actual period stop. And like you said, you don't get a notification for it. Things just start to change. Maybe your periods start to become a little bit irregular, or your cycle gets a bit shorter. One of the big symptoms is insomnia, and obviously that doesn't help towards your memory issue as well. Women feel, like you said, anxious, panic attacks, flatness in mood. So these are symptoms that start to occur in perimenopause, which women aren't really sort of putting, two and two together and considering them as menopause, because we've been told menopause is sort of hot flushes, irritable, grumpy women with moustaches or something like that. We haven't really been told that perimenopause, or the symptoms, can start sort of early on in your 40s, that they can be psychological, they can have sort of a wider impact than women think that they might have done.
So you may well not experience any of the physical symptoms, but the psychological symptoms show up first. So it's really worthwhile having, as you say, is it 5 or 10 years before perimenopause, having an appreciation and helping to get that education out there that, think menopause. It could be start of your menopause journey. Absolutely. So that's what's going on in our body then. The hormones are disrupting, and psychological symptoms can occur at this time. What can we do about it?
Yeah. So one of the things is, with regards to brain fog, with regards to general health, and with regards to sort of preparing for our future, we really need to sort of take stock at this point in time, to improve or change our lifestyle habits. Something like exercise. Exercise is great. It helps to improve circulation to our brain, so that brings more oxygen there. So it will also help in the sense of with brain fog, memory and mood. Also, it helps to release those happy neurochemicals, serotonin, dopamine, noradrenaline, which help us feel good and make us feel positive. So it's really important to exercise. And when I'm talking about it, I'm not saying that you have to be running marathons, but you do need to get a bit of a sweat, get the heart pumping a little bit. Also, maintaining hydration, drinking water, so you're not getting headaches. Yes, absolutely, Deborah. Thank goodness for that. Yeah. Thank you for demonstrating. So drinking water, keeping hydrated, and also things like stress management. I think we sometimes forget what a stressful life we live in. Taking a bit of time out, thinking about mindfulness, thinking about sort of yoga, something that that will help you sort of unwind, sort of calm down. Even taking things like supplements like magnesium, vitamin B12 is very good for the brain and for mood. Always vitamin D. I always talk about vitamin D. And actually, I think something that maybe people aren't so aware about when it comes to general health, and particularly with brain, is sort of the omega-3s and the fatty acids. They very much help with improving sort of that connectivity in the brain, and raising our good cholesterol and lowering our bad cholesterol. So all those lifestyle measures. Stopping smoking. I mean, I sort of didn't say that because I thought, everybody must know, stop smoking and drink in moderation. But these are really important things, because smoking, what that does is it narrows your blood vessels, and so it reduces circulation. It causes vasoconstriction, and along with things like heart disease, lung cancer, it also does affect your brain health as well. And just recently we had a study from UCL showing that obesity increases your risk of dementia by 30%. What they were really trying to say was all of those risk factors that make you increase weight or cause weight gain are things that we need to be addressing. Eating a Mediterranean diet, stopping smoking, and drinking in moderation, taking exercise, and taking the right supplements.
And all of that is great advice from a lifestyle point of view. And we all know we should be doing that, of course. With COVID, it's not always that easy, is it? But so we've got to make conscious decisions about our lifestyle. You also mentioned stress there. Because at this time of life, I'm thinking of so many people on our colleague sessions are saying, well, they're worried about COVID, they're worried about working from home, they're worried about maybe even having a job. They may well be homeschooling because we're having children later. They may well have parents that they're shielding, and they've got menopause. It's not a happy mix, is it? And stress and menopause aren't good bedfellows.
No, and stress, menopause, and lack of sleep, all of them are not good bedfellows at all. So I think we do need to, as women, maybe prioritize ourselves a little bit, give ourselves a bit of time out, not be so tough, like you mentioned at the beginning, putting in coping mechanisms. There's no shame in making a list. There's and actually it's a good way of doing things. It's I often say to people, just dump everything down in a list and take out a few things at a time. So, and tick them off. And that gives a sense of satisfaction as you go along. So do things in bite sizes, where you can make those changes. Some things we can't control. We can't control this pandemic in the sense of coronavirus. Yes, we can do all the sort of safe things, but this is something which is out of our hands at this moment in time. So there is going to be a low grade anxiety with regards to that. But maybe there are things that you don't need to be worrying about so much, or you can deprioritize them and just maybe stay in the here and now rather than focus too far along.
Thank you very much. And what about the medical side? I know you're very passionate about the holistic, and I think your Instagram is great for bite-sized chunks of knowledge. So I'd highly recommend following Dr Shahzadi Harper on Instagram. But what about the medical side? I take HRT. Is that helping me?
So yes, it is, because we know that estrogen helps sort of the memory center in the brain, the hippocampus, that helps to sort of connect our words and keep us sort of our memories sort of at the forefront. But it's not just HRT that we need to think about. Around this time, a lot of women may have other things going on. You may have heavy periods, so you might have iron deficiency anemia. That will make you feel tired, that will impair your concentration, that will give you anxiety. Things like an underactive thyroid also makes you feel sluggish and tired and gain weight. A lot of women may be deficient in vitamin B because they're eating a more plant-based diet. So I think it's important to look at, could it be something else going on alongside this? But yes, if it really is affecting and impacting you on a day-to-day basis, from a work perspective, a home perspective, then something like HRT, I'm very much an advocate of that, but sort of dispelling the myths around it. And it's for each individual to make that decision, but with the right advice and information given to them. So yes, a lot of women, particularly women who are in the workplace, who have had maybe scenarios like yourself, Deborah, along with making all those lifestyle and holistic changes, they are also, considering and taking HRT alongside it.
Thank you. And of course, not everybody wants to, not everybody can. So it's worthwhile looking at the lifestyle as well as looking at any medical approaches. I had one woman yesterday who shared her menopause story with me, and her psychological symptoms were around anxiety. And she really didn't want to take HRT. She wanted to try and manage everything naturally. But her GP had given her some medication for anxiety. And she said she felt on top of the world within a fortnight.
Absolutely. So for some women, hormones are not the answer, or they can't tolerate them. So there are other things. I had a patient yesterday actually, who's on an SSRI, fluoxetine, for anxiety, and it's also helped with her hot flushes and her sleep. So there are lots of different ways that we can manage each individual woman according to what she would like, as long as she has the right information in front of her. And something like anxiety can be so debilitating. I've had women say they've stopped driving because of it, or some women don't even go out because of it. I mean, some women are saying they quite enjoy the COVID situation and lockdown because they're not having to go out and socialize, because that provokes anxiety for them. So yes, there are different tools in the toolbox, for each woman.
But what we shouldn't be doing is ignoring it. If it's getting in the
No.
way of enjoying our life or our work, don't ignore it. There's a lot that you can do.
Absolutely. And it's not there forever. We know that during this process, and we've talked about perimenopause, menopause, but post-menopause, it doesn't mean to say because you've got it now, it's going to lead into Alzheimer's or it's going to last forever. For most women, it does improve, sort of post-menopause. But obviously, there are some women who for whom who may have a family history, who may develop Alzheimer's or dementia, because we know that postmenopausal women, twice as many women get dementia compared to men. And some of it is, yes, because we live longer, but some of it also could potentially be because postmenopausally, we've lost some of that protective effect of estrogen.
Thank you very much. So you're giving me some hope. Well, I'm 11 years, 11 years into my transition, I believe, post-menopause. Will I ever get my memory 100% back?
So going back to what I said at the beginning, remember aging. Okay, remember the fact that that is something we can't do anything about, irrespective of us doing all of those lifestyle sort of factors and things. So I usually say to people, your memory will improve, but it may well not be the same as when you were in your 20s. There are lots of factors, aging, but also life, stress, anxiety, doing a lot of the things that we're doing nowadays as women, much more so than what we were doing in our 20s. So definitely it will improve, but don't expect it to be the same as it was. I think there has to be a level of acceptance as well, that, like you said, you're having to make lists, which probably 20 years ago you could remember everything in your brain. And I'm very much that person. I used to think I have a fantastic memory and never used to even write things in the diary, but now I'm writing things in the diary and making lists and being a bit easier on myself about it as well, and understanding, just as I said to everybody else, life is much more busy and complicated than it was before.
Thank you. So be aware, understand that you can do something about it, and take action if it's getting in the way. I'd also probably say, because I think my family find it quite amusing, I seem to have lost the file in my brain that's marked names. I can remember a lot of things, but I cannot remember names. So I was wandering around the supermarket and shouted Tom Hardy. It came from nowhere. My family thought it was really funny, and there was something. And I was trying to remember the star of a film. And I actually love Tom Hardy anyway. I'd shout Tom Hardy in a supermarket any day. But it was 3 hours before, and they were saying, Mum, that was 3 hours before. I couldn't remember the film we were trying to do. It just popped into my mind. So sometimes when I relax about it, let things happen, but also that acceptance, and you know what, I'm still me, even if I do shout strange things in a supermarket.
And it's bound to happen to us all occasionally. And like you said, own it. Don't sort of get embarrassed, just sort of say, and I've done, like you mentioned my Instagram, I've done lives and things, and in the middle of it I thought, oh, I've had a brain fog moment there, and then it'll come a little bit later. But I think you should just own it. You should just say it then and there, and the more that we talk about it, the more we're raising awareness.
Yeah, I love that, owning it, because it is just one of those things sometimes. And I know one of a CEO of an NHS trust that we were working with opened up her conference by saying, I'm struggling with hot flushes, brain fog, and I feel really fat today. And it was like there was a sigh of relief, because everybody's going, so it's not just me then. If the big boss can experience this and can actually say, this is what I'm experiencing, then it makes it okay for everybody else.
Yeah, absolutely. And it's the same for myself. Yes, I'm a doctor, but I'm a woman. And I'm going through these stages myself. So there are times when things do sort of evade me, and they just sort of, it feels like my brain's gone empty. But that's perfectly normal. We all go through it, just as we all go through menopause.
We all go through menopause, and at our own pace. I would also say don't dwell on it too much. We don't all get all of the symptoms or anything. Some of us can sail through it, but actually information, education is absolutely crucial during this time. Sally, if I can invite you, have we got many questions at all?
Yes, we've got a few actually. One really leading on from what you've just been talking about around the loss of nouns. So you were talking about the loss of names, but someone's saying about the loss of, so and I, exactly like you, Deborah, with one of the organisations that we worked with, someone who's the head of midwifery at a university was doing a lecture, and she said she couldn't remember the word for a scan. And so she was the thing that you use to take a picture when you're doing it, and someone had to, and she explained it, and she said for her that owning it actually was really helpful, because she was talking to a group of students who were going to be working with women, and it actually really helped to open that conversation that this is part of menopause and part of that menopause journey. So I just thought that's a really interesting one. We've got somebody asking, how do you know if your forgetfulness is normal or is actually the sign of something like Alzheimer's or dementia?
Yeah, that's a really important question, because not everything is down to your hormones. And I think that's always something that I say to people, just because you've got this symptom and you happen to be in this point of life, let's not forget it could be caused by something else. So, if it's consistent, if it's regular, and if, one of the things with brain fog and for women in this sort of menopause transition is it tends to be fluctuant. Some days are better than others. There are you know, but with something like dementia, it is a consistent decline. And also, if there's a family history of it, be a little bit more aware. And obviously, there are tests that you can have done in the sense of going to see a specialist to make that assessment. But I think, one of the things that your GP can do initially is to do those blood tests that I've talked about, that could be contributing towards things like the anemia, like the vitamin D, like the thyroid, and also, check your blood pressure. If you've got high blood pressure, then that reduces blood flow and circulation to your brain. Check what your cholesterol and lipid levels are. I mean, these are all risk factors for sort of dementia in the future and things. So it is something which is much more consistent and a downward decline rather than the fluctuant sort of brain fog that you get in perimenopause and menopause. Yeah.
That's really helpful. And someone's also asked about their premenopausal. Will making changes in their lifestyle, exercise and eating, etc., help them with their memory and their brain fog long term if they start earlier?
Absolutely. We know studies have shown with regards to the sort of the bad cholesterol and the good cholesterol. So all of these things make huge changes or make, you're preparing for your future. And these changes, these lifestyle changes, one should be implementing them throughout life. There's not a point. It's not when you turn 40 that you do it. You should be stopping smoking whenever you can. You should be being moderate when it comes to drinking alcohol. But Mediterranean diet, it's something that we as doctors recommend all the time to everybody. Having oily fish, omegas, the linoleic acid, from the oily fish is really good from the point of view of brain health. So so we should be thinking about it all the time. We should be thinking about things like exercising our brain, doing puzzles, Sudoku, things like antioxidants very much help. Things like, we talk about superfoods like pomegranate, blueberries, dark chocolate. These are all good brain foods, and doing things like classical music has been shown to help with the neuronal activity and sparking them off in the brain. Doing tango dancing, getting your brain to think about things in a different way. So premenopause, everybody should be doing, we should be trying to do this throughout our life. But I'm just saying, if you haven't been, now is the time to really take stock and sort of put yourself first and your health first.
Excellent. And just on the note of exercise, someone's asked around that they're struggling with exercise, they're menopausal and have an underactive thyroid. Is there any good exercise apart from walking or running they're really struggling with it. So they're on HRT and they've dealt with most of the symptoms, but the weight gain's really getting them down. So just any kind of recommendations from an exercise point of view?
So I usually say, think about exercise almost like a prescription, like medication. And instead of trying to do, one long session, I try and say to them to do two 12 to 15-minute sessions, sort of morning and night, or, morning and evening, and trying to break it up like that. But I would say that if you're really struggling with your weight, then maybe it's time to have a review of what's going on with your medication, your HRT, your thyroid. There could potentially be other things that could help, and even possibly other medications that might get you over that hump to get you losing weight that you can then continue. And that's something, a lot of women worry about and get stressed about weight gain. And sometimes they do need a bit of a helping hand to get them moving and also motivated and get and energized to do it. Yeah.
Excellent.
Thank you, Sally. Can we ask the CBT question? Was that what you were just about to ask?
Yeah, go for it.
I think this is great. We had a CBT session last week and we're having a practical one next week. So we'll give you some CBT exercises to do. We're great fans of CBT at Henpicked. There's two actually in the questions. One woman, I really feel for her. I've been invited to a 2-day course next week and I'm terrified that my brain fog is going to make me fail the written assessment. I'm getting more and more anxious about it. And actually, the more and more anxious you get about something, the more likely it is to happen, isn't it? Because you're stressing your body out. And I think this is where CBT is incredibly helpful. So I've taken a note of the name, printed it off, because I'll be sending you some of those CBT materials to do, because CBT is amazing, both for hot flushes and psychological symptoms. It's a tool and technique with a huge amount of research behind it. So actually that acceptance of it, the positive, not the positive thinking, the managing your critters, if you like, your stress during this time, that's absolutely excellent. Do you do a lot of CBT, Dr. Harper?
Yeah, I mean, it's about sort of rewiring your brain in a way, like rethinking things, because, sometimes with anxiety, it can be quite irrational. Even if you break it down yourself, you think, I know it's irrational and I don't know why I'm reacting in that way or why I'm feeling that way. So I think it is about sort of, like you said, first of all, understanding what your triggers are, what's going on, and trying to rethink about it and reorganize your thoughts and the wiring. And I think it's very important. And along with anxiety, if she's getting very anxious, she may well also not be sleeping so well. So it becomes a chicken and an egg situation here. And this 2-day course then becomes this huge mountain for her to climb. Whereas, she needs to sort of learn or get some coping mechanisms in place to de-escalate it, break it down, and give herself that confidence back that she can do it, but and not like you said, to sort of calm those demons.
Thank you very much. Sally?
I was just going to say, lots of people have been asking for CBT information, so we'll share the link for the session we did with Dr. Myra last week, and also the information on the one that's coming up, because I know, CBT is I think people are wanting to understand more about how it can affect you, the positive impact and the things that you can do. We've just had the final one, was just asking around how much exercise should we be doing? Should we be doing it daily, and for how long? Are there any particular guidance on, in particular, the impact that can have on our mental health and our brain fog?
Yeah. So there are guidelines, and one of the great websites or resources is actually the NHS exercise resources site. And the recommendations are 150 minutes of what we call moderate exercise per week. And that's something like, walking fast or jogging, being able to keep a conversation going, but not being able to sing, playing a doubles game of tennis. I always think these are kind of strange ones to say, because we can't do any of these at this particular moment in time. So, moderate exercise is getting your heart pumping a bit, a little bit of sweat, and that's 150 minutes per day. So dividing it up, and ideally, I would say, daily, or at least doing it maybe 3 or 4 times a week. Or you can do 75 minutes of more higher intensity exercise, which is more running, dancing, really getting more of a sweat on, getting that heart racing, so you can't sing while you're exercising. And again, I would say to break it up throughout the week. alongside it, you also need to do some strength training. So about 20 minutes, 20 to 30 minute sessions of strength training. And that doesn't mean bodybuilding. It means things like, sort of gentle weights or yoga, even using your own natural body weight, because around this time, we talk a lot about sort of hormonal changes, but we also are losing muscle mass because of the other hormone, testosterone, which we don't often talk about that much. Our metabolism slows, and it's also very important from our brain and mental sharpness point of view as well. So we need to do some strength training, yoga, gentle body weights, things like that, to maintain and keep our body, our muscle bulk going.
That's brilliant. Thank you.
Thank you very much, Sally. And we have one question that's employment law. I would urge the individual, if you want to get in touch with me, because it's outside the scope of this this session, but I'd be very happy to answer that question. And it's deborah@henpick.net. And one final thing, we did have one person who said to us, can you, if estrogen is that important to our bodies, why don't GPs prescribe it to us all? I know that's a little bit of a tricky one, but I wanted to ask that question before we summarise the session and next steps for everyone.
Yeah, I think it's a really good question. I mean, we've spoken a little bit about there are some women who can't take hormones because of their medical reasons, like breast cancer, liver disease. So there are some reasons why some women potentially couldn't take any hormones. And from the point of view of saying, should everybody be getting some estrogen because it's so good for our bodies? Maybe that is the way that we might be going in the future, as we get more and more safer preparations and the more that we know and find out about it. But also, there's a lot that is individual choice. We are individual women, we have our own choices, we have our own ways that we want to lead our lives, and we have different sort of priorities and needs. So I think it's a joint conversation. I don't think it should just be dished out. I think it should be in conjunction with each individual. But maybe moving forward in the future, there may be more talk of that rather than less talk of it.
Thank you very much, Dr. Shahzadi Harper. I know that you're a big advocate of informed choice as well. So there's lots of webinars that we've done that I'll make sure that we attach. The one that you mentioned about myths around HRT. But in summary then, brain fog, psychological symptoms can happen. Don't dwell on them too much. Doesn't necessarily mean like we're all going to forget absolutely everything. So, keep it in control and own it, I think was what you were saying. Understand that it can happen at whatever stage or as a stage during the menopause transition, but do get some help. It's not something, there's a lot that we can do about it, both lifestyle, naturally, and from a medical point of view, and that's absolutely key. So thank you very much. Anything final to say, Dr. Harper?
No, I just agree with you, and I'm just going to sort of reiterate, almost like Sally's point earlier that somebody made, these lifestyle changes, we should be trying to do them throughout our life. There's not a certain point that we should be doing it. And if you need help with some of them, go and see your doctor. If it's weight, if it's stopping smoking, if it's to get some nutrition advice, it's something that we should be doing, whenever we can, and throughout the stages of a woman's life.
Thank you very much. As always, Dr. Harper, it's a pleasure talking to you again today. And thank you very much, Sally, for the Q&A session. And thank you very much for joining us. Next time we will be doing CBT, or we'll be talking about CBT style techniques again. So we hope you'll join us. Thank you very much.